So let's look at an overview again and then go through all the cranial nerve nuclei here. So we have the motor nuclei, 3, 4, 6 and 12. Next to them, just laterally to them, is the visceral motor, Edinger-Westphal, superior and inferior salivary, and dorsal nucleus of 10. Further lateral to them is the visceral sensory solitarius, but in the same column we will also find the branchiomotors, the mixed nerves which do control skeletal muscles, yet they are related to the function of the GI tract as described before. So motor 5, motor 7 and ambiguous. And lastly, most laterally, we will find the somatic sensory 5, the one which spans across along the entire brainstem, and at the pontomedullary junction, pontocerebellar junction, we will find number 8. So in summary, we have 4 columns of nuclei, cranial nerve nuclei, along the brainstem. So that's the midline. Closest to the midline would be the motor column. Motor 3, 4, 6, 12. 3, 4 midbrain, 6 pons, 12 medulla. Next to them will be the autonomic motor line or column, and this is Edinger-Westphal, superior and inferior salivary, dorsal 10. So far we have 4 in each column. Lateral to that is a bit of a mixed column, because we have the autonomic sensory, the only one, the solitary nucleus, but we also have branchiomotor nerves as well, and they are motor 5, motor 7 and ambiguous, and yet again 4 nuclei in there. And lastly, most laterally, is the sensory column, and that sensory column, the somatic sensory column, which has the sensory 5 and the vestibulocochlear. It's only 2, but if we calculate that the first 2 cranial nerves, number 1 and 2, are also pure sensory, however they don't go through the brainstem, we could also think about the magic 4 again. Cranial nerve 11, the spinal accessory nerve, does not have its own nucleus in the brainstem. Its main nucleus, found in the C1 to C5 cervical vertebral levels, and that's the spinal part of it, but its cranial branches would come together with 9 and 10 from the ambiguous nucleus.